Topic is cervical sympathectomy. Cervical sympathectomy. Dear students, we'll discuss a topic, an operative procedure actually, which is not that commonly done, but very important, that is used for upper limb ischemia, cervical rib, hyperhidrosis and so on. Just see this, see that incision you can see over the clavicle, you can see below the neck, just above the thorax, the incision, transverse incision is made, we went deep and we have cut sternocleidomastoid muscle, then we identified carotid sheath with the IJ which retracted medially, then we could identify the scalenus anterior muscle which was removed, which was cut carefully, and we identified phrenic nerve which was retracted carefully without injuring it. Then we will go to the deep place, then we can identify the thoracic duct because it is the left side, not if it is right side there is no need. So thoracic duct is identified and safeguard is very important. Then you go deep medially, you can feel the T1 rib, T1 vertebra, then T1 rib. Over the neck of the T1 rib, we can feel the cervical sympathetic chain, stellate ganglion. So T2, T3 ganglia are removed and lower part of the stellate ganglia is removed. And their important thing is Simpson fascia is there, condensed fascia attached to that apex of the pleura. That should be cut and pleura should be shifted downward, and then you can have a dissect, very narrow angle, pyramidal conical angle is there, that you have to retract adequate, you should have good retraction, good light source, so that you can identify and feel it, tough, vertically running, firm structure. There's nothing other than stellate ganglion and T2, T3 ganglia. That you cut, never cut upper part supplies the head and neck, and unnecessarily it will cause the Horner syndrome and so on. Whereas the lower part you have to cut, that increases the perfusion and sympathetic action over the upper limb and leads into improved circulation and whatever the result which you want for the whatever the condition you want. So that is called cervical sympathectomy. So very important thing is cut the scalenus anterior, retract phrenic nerve, retract jugular vein, and cut the Simpson fascia. Take care of the thoracic duct left side, then Simpson fascia you cut, push it, remove the ganglia, send it for histology, then put a drain and close. That is cervical sympathectomy. What are the indications? And second and third thoracic ganglia are removed. These are different indications I have already told: hyperhidrosis, Raynaud's phenomena, upper limb causalgia, acrocyanosis, and all these individual conditions. All these individual conditions are short note. Remember, you can go through my book and I understand about each topic. And approaches are supraclavicular, transthoracic, thoracoscopic. This is the popular, most commonly very easy thoracoscope. You can see the, identify the pleura, everything there. You can either with the rib, you can remove the ganglia, identify ganglia, everything can remove. So what I have done is supraclavicular approach here. That is again technically quite easy. If you know the anatomy, complex neck anatomy, you should have very clear idea. Approach steps, you should have very clear idea. And complications are bleeding, injury to IJV, thoracic duct, chyle leak, then injury to the subclavian vessels, because you push the subclavian vessel once you cut the scalenus anterior muscle, you can see that you can carefully, gently push it down. Then pneumothorax can occur, and so that also you may have to check chest X-ray to confirm that there is no pneumothorax. If it is there, you may have to put ICT as such. And post sympathectomy, neuralgia, these are the different complications, not that common. If you know the steps properly, one by one, accurately, it will not cause any problem, even not much bleeding actually. So that is the cervical sympathectomy. And students answer the MCQ. A patient who has undergone bilateral lumbar sympathectomy presented with infertility, what would be the cause? Removal of both L1 ganglia, removal of both L2 ganglia, removal of both L3 ganglia, removal of both L4 ganglia. So put the right answer in the comment box. I'll get back to you. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in a table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB Manual of Surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My digital lectures through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.